Okay, I'm here with Molly, and she's going to talk a little bit about her job. First, can you introduce yourself?
Yeah, so my name's Molly. I'm an occupational therapy assistant here at Sullivan Park Care Center. It is a nursing home, as most people know it as, but it is actually called a skilled nursing facility. So I'm on the rehab team. I'm in the occupational therapy department, and with me is the speech therapy department and the physical therapy department, and we work in this building together with social services and skilled nursing.
So, you talked about your title. What's the difference between an assistant and an occupational therapist?
So my official title, is occupational therapy assistant, and that differs from an occupational therapist in the way that they need a master's degree versus I am a technical degree from, I got mine from the Falls, but it's an AAS, I believe it's technically called, and they have a master's, we're an AA, and then when a patient first comes to us, the therapist does the initial evaluation, and they kind of set, why is this patient here? What do they need to work on? What goals are we going to create for them to be as part of their care plan, we call it. And me as an assistant, I go and I treat that patient. So under the guidance of the occupational therapist, and those guidelines and rules and regulations differ from state to state.
Okay, and so what does a normal day look like for you?
So occupational therapy can be in several different settings, but here in the rehab center, it looks like I can see anywhere from 4 to 13 patients a day, and I can see them for anywhere between 15 minutes long to an hour long treatment sessions. And all I'm really doing in those sessions is I'm greeting the patient, I'm getting to know how they're doing that day, how are they feeling, what's their pain like, kind of discussing why they're there. A lot of my patients have cognitive delays or disabilities or they have dementia, and so it kind of takes a lot of coaxing to do therapy sessions and education as to why is this important, why are we doing this. And anyways, so then I just do the treatment based on whatever the therapist wrote as their goals. So a lot of things in occupational therapy focus on taking care of yourself, bathing, dressing, toileting, managing your medications, your finances, anything that they have to do to be able to go home and live independently is what I focus on in my treatment sessions. So I really like this setting, working in a long-term care rehab center mix, because I really get to work with people on what do they need to be able to do, not necessarily what do they want to do. And so it's very important for people to work with me and work in occupational therapy, because it's the difference between staying here, long-term care, or going home to their loved ones. So it's there's a lot of variance in my day today.
Okay, so what type, you mentioned that you had to have a degree from SVCTE.
Mm-hmm.
Is that everybody in your position have to have an associate's degree? Is that?
From what I know, there is maybe a year of prereqs, and then you would apply to the SVCTE here in the area, SVCTE OTA program, and that's another 2 full years. So I did my first 2 years in college at the Falls, getting my AA, and then I transferred out to Eastern to get my bachelor's in pre-exercise science with a focus on occupational therapy, and then I came back to the Falls and got my AAS in OT. So it just I would say 3.5 years from high school to you're working would be my guess.
Okay, so what is your favorite part of the job?
Working with my patients. I absolutely love the elderly generation and that whole lifestyle and characteristics of the elderly. I've also worked with kids, and I have found my passion working with the elderly. So I love all their wisdom and all their jokes and all their, it's just fun. It makes it an interesting job for sure.
So what are the toughest parts of your job?
The sadness. We are end of life care, so a lot of folks that we get to know and work with end up passing away. Unfortunately, we try to make their last couple years of their lives the best it can be and the most independent, but it's a factor here. And with COVID striking our building, it's been a lot more, unfortunately, deaths than I was used to. So I would say just losing people that you kind of really get to like and know losing them suddenly and unexpectedly is hard, or just them discharging home, which is we're happy for because that's our end goal, but it's still kind of sad to have all those people leave after you end up really liking them and enjoy spending time with them.
So, who might have inspired you to get into this field of work?
When I was young, actually in high school, my grandparents were elderly. They're in their 80s, and they ended up having OT, occupational therapy and physical therapy, in their home. And I was able to see, the impact that they had, that the therapists had on my grandparents, and that they were able to take them from a nursing home in a hospital bed and help them get back home with their spouse and with their family. And so we could go visit them and give them, again, the best life possible at the end of their years. And I ended up having family friends that were in occupational therapy. I had a occupational therapist and a certified occupational therapy assistant family friend that I was able to do lots of job shadowing with, and it's been the only career I have ever wanted since I was like 14. So it's been, so that would be my main inspiration, is my grandparents.
So is there anything you would have done different or would do different?
I think about that sometimes. It's like, what other jobs would I ever want to do? And I can't think of myself in any other profession, honestly.
Is there anything else you'd like to share with students, middle school, high school, as they're making choices in their career?
Well, normally I would say get out there and job shadow. Try to do as many job shadowing hours as you can. I had family friends, but we working in a rehab center, we get calls all the time from students. Hey, can I come in and shadow you for 3 hours on Saturdays, or Thursday afternoons, just to see speech therapy, physical therapy, or occupational therapy. So just get out there. I know it's hard right now, like our buildings aren't allowing students right now. So interviews like this would be really nice, or Zoom interviews, or just doing your research, I would say. And when things clear, definitely do as much job shadowing as you can, just to see if you like it or not, because it's good to know whether you like it before you start school.
Okay, thank you, Molly.
Thank you.